Depression during pregnancy. Brought to you by Discover Parenting. What is depression? Depression is a condition that affects your emotional state. It can cause you to have feelings of sadness and disconnection. A depressed mood is a normal reaction to loss, change, life struggles, or self-esteem issues. Is it common to get depressed during pregnancy? Depression is almost as commonly seen in pregnant people as it is in non-pregnant people. This condition can happen at any time in your life, including during pregnancy. What factors increase my risk of being depressed during pregnancy? There are many different factors that can add to your risk of developing depression during your pregnancy. These risks can include having a history of depression or premenstrual dysphoric disorder, PMDD. Your age at time of your pregnancy, the younger you are, the higher the risk. Living alone. Having limited social support. Experiencing marital conflict. Feeling ambivalent about your pregnancy. Does pregnancy cause depression? Pregnancy can cause you to experience depression. Your body goes through a lot of change, and the stresses of pregnancy can trigger depression in some people. Not everyone who becomes pregnant will also be depressed. It's important to talk to your healthcare provider about depression during pregnancy because it can extend after delivery. People who experience depression during pregnancy are at a higher risk of postpartum depression, depression after the baby is born. What are some of the signs of depression during pregnancy? During pregnancy, your body goes through many changes. You may experience a lot of different emotions throughout pregnancy, sometimes carrying you up the emotional roller coaster, and sometimes down. It's okay to feel all of these different emotions. Signs of depression during pregnancy can include 1. Having recurrent thoughts of death or suicide. 2. Having a depressed mood for most of the day, nearly early day, for the last 2 weeks. 3. Feeling guilty, hopeless, or worthless. Having difficulty thinking, concentrating, or making decisions. 4. Losing interest or pleasure in most activities. During the day, nearly every day, for the last 2 weeks. How does depression affect pregnancy? Depression during pregnancy can affect you by interfering with your ability to care for yourself. It's important to take care of your own health during your pregnancy. Depression can cause you to push those personal needs aside. If you're depressed during pregnancy, you might be less able to follow medical recommendations, as well as sleep and eat properly. Your ability to bond with your growing baby. While the fetus is in your uterus, it can actually hear you talk and can sense emotion by the pitch, rhythm, and stress in your voice. If you're experiencing depression during your pregnancy, you might find it difficult to develop this bond with your baby. You might feel emotionally isolated. What are my options if I'm depressed during pregnancy? Resisting the urge to get everything done. Cut down on your chores and do things that will help you relax. And remember, taking care of yourself is an essential part of taking care of the developing fetus. Talking about your concerns. Talk to your friends, your partner, and your family. If you ask for support, you'll find that you often get it. But if you are not finding relief from anxiety and depression by making these changes, seek your healthcare provider's advice or a referral to a mental health professional. Are antidepressant medications safe during pregnancy? Growing evidence suggests that many of the currently available antidepressant medicines are relatively safe for treating depression during pregnancy, at least in terms of short-term effects on the fetus. Long-term effects have not been fully studied. You should discuss the possible risks and benefits with your doctor. Thanks for watching. Like, comment, and subscribe.